Okay, so imagine this. You're about to walk into an interview for a respiratory therapy technician position. Are you feeling those butterflies yet?
I bet.
Yeah, totally normal. But that's why we're here today for this deep dive. It's like your secret weapon.
Exactly.
We're going to unpack RoleCatcher's career guide and their interview guide so you can walk into that room feeling confident and totally ready to rock.
We're talking about standing out from the crowd. These guides are packed with insights that you just won't find anywhere else.
Exactly. And did you know that the job outlook for respiratory therapy technicians is projected to grow at like a whopping 19% over the next decade?
Wow.
Yeah, it's way faster than average. And we pulled that straight from the career guide. So not only is this a rewarding career, but it's also a really smart one.
For sure.
But there's a catch, right? More and more companies are using these automated systems to sift through applications.
It's like a digital maze that you have to navigate. But the thing is, RoleCatcher's AI is designed to help you crack the code. It's not about gaming the system, it's about understanding it. Their platform helps you tailor your resume and cover letter to highlight the exact skills these systems are looking for.
It's like your personal resume whisperer. But landing an interview is just the first step. What happens when you're actually sitting across from the hiring manager?
That's where the interview guide comes in. It's like having a sneak peek into the minds of the interviewers.
I love that, a sneak peek. Okay, so let's talk about some of those classic questions.
Yeah, the ones they almost always ask.
Like, why are you interested in respiratory therapy? It seems simple, right? But there's a real art to nailing this one.
You have to go beyond that generic answer of, I want to help people.
Right, they hear that all the time. You want to give them something that truly resonates, something that shows you're not just interested, but you're genuinely passionate about this field.
So think about what really sparked your interest. Was it a personal experience, a specific moment in your studies, a shadowing opportunity that really stuck with you? Dive into the why connected to your own personal journey.
Yeah, they'll see right through a canned response. This is your chance to showcase who you are and why you're the perfect fit for this role. Now, brace yourself for a potential follow-up question. They might ask, okay, so what specifically about respiratory therapy excites you?
Ooh, this is where you get to geek out a little bit.
Yes.
Did a specific procedure fascinate you during your clinicals? Is there a particular patient population you're drawn to working with, like pediatrics or geriatrics? Let your enthusiasm shine through.
They want to see that spark, that genuine passion that will make you a dedicated and engaged respiratory therapy technician. Get ready for another common one. How do you stay updated on the latest advancements in respiratory therapy?
Well, healthcare is constantly evolving.
Yeah, new technologies, treatments, guidelines.
It's a whirlwind of information. They want to know that you're committed to lifelong learning, to staying at the forefront of your field.
This is where you showcase your proactive side. Talk about professional journals you subscribe to, conferences you've attended, or online forums where you engage with other respiratory therapists.
Even following thought leaders on social media shows you're actively seeking out knowledge and staying in the loop. Bonus points if you can mention a specific recent advancement that caught your eye, shows you're truly invested in the field.
And don't just rattle off a list.
Right.
Pick one or two examples and elaborate a bit. What did you learn? How did it change your perspective? That's what they're looking for, that depth of engagement.
Now here's one that can really trip people up. Describe a time you had to prioritize multiple tasks and how you handled it. Get ready to paint a picture.
All right, so picture this. You're in a busy hospital environment, multiple patients needing your attention. Maybe an emergency situation arises. How do you stay calm, collected, and ensure everyone receives the best possible care?
Think back to a time when you faced a similar situation, even if it wasn't in a healthcare setting. Maybe it was a demanding job, a volunteer role, or even just juggling a hectic school schedule.
Right, what was your strategy? Did you create to-do lists, prioritize tasks by urgency, use a time management technique? The key here is to demonstrate your organizational skills and your ability to handle pressure effectively.
Don't just say you're organized, prove it. Walk them through your process. Highlight your ability to adapt and make sound decisions even when things get chaotic. That's what will make you stand out. Now let's shift gears a bit and talk about communication.
Okay.
One question you might encounter is, how do you communicate with patients and their families about their respiratory therapy treatment plan?
This is where empathy meets clarity. Remember, you're working with people who might be feeling vulnerable, overwhelmed, and possibly confused about their medical situation. It's your job to make them feel heard and understood.
And to explain things in a way that makes sense even if they don't have a medical background. Ditch the jargon, speak plainly, and be patient.
It's about meeting them where they are, acknowledging their emotions and building trust. Imagine you're explaining a complex procedure to your own grandparent. How would you approach it? That's the level of compassion and clarity we're talking about.
And remember, everyone communicates differently.
Yeah.
Some people want all the details. Others prefer a more concise approach. Be adaptable. Observe their cues and adjust your communication style accordingly. Now, be prepared for a follow-up question that digs a little deeper. They might ask, can you give an example of a time when you had to explain a complex medical procedure to someone without a medical background? How did you approach it?
That's a good one. So think of a time when you had to break down a complex topic for someone who wasn't familiar with it. Maybe you taught someone how to use a new software program or explained a difficult concept to a friend.
The key is to highlight your ability to simplify information. Use analogies and check for understanding along the way. Demonstrate that you're not just talking at people, you're engaging them in a meaningful way. All right, let's tackle another question that often comes up. How do you collaborate with other members of the care team, such as physicians and nurses?
This one's all about teamwork. They want to know you understand that healthcare is a collaborative effort. You're not working in isolation. You're part of a team that's all focused on providing the best possible patient care.
And that means being a good communicator, an active listener, and someone who respects the roles and expertise of others. Highlight your ability to take direction, give feedback constructively, and work together seamlessly towards a common goal.
They might even ask you to describe a specific situation where you had to work as part of a team to achieve a common goal.
Think of a time when you had to collaborate effectively, maybe in a school project, a volunteer role, or even a part-time job. What were the challenges? How did you contribute? What did you learn from the experience?
It's all about showcasing your ability to be a valuable team player, someone who's reliable, communicative, and dedicated to working together towards a shared vision. Speaking of dedication, let's move on to a question that's all about safety. How do you ensure that patient care is delivered in a safe and effective manner?
This one goes beyond simply following procedures. It's about demonstrating your commitment to vigilance, attention to detail, and proactive thinking when it comes to patient well-being.
So imagine yourself in the role. You're not just going through the motions. You're constantly assessing the environment, identifying potential risks, and taking steps to mitigate them.
Talk about your understanding of safety protocols, your willingness to speak up if you notice something amiss, and your commitment to double-checking your work.
They want to see that you're not just a rule follower, but a true advocate for patient safety, someone who's proactive and always thinking one step ahead. Now get ready for a potential follow-up question that might throw you a curveball. Have you ever encountered a situation where you felt a patient's safety was at risk? How did you handle it?
Ooh, this is your chance to shine. Share a specific example that showcases your critical thinking skills, your problem-solving abilities, and your unwavering commitment to patient safety.
Okay, think back to a time when you had to make a tough call, maybe in a fast-paced environment or a situation where there was potential for error. How did you assess the risk? What steps did you take to ensure the best possible outcome?
Highlight your ability to remain calm under pressure, communicate effectively, and follow proper procedures. This is your opportunity to demonstrate that you're not just knowledgeable, but also capable of handling challenging situations with grace and professionalism. Now let's dive into a question that requires a delicate balance of professionalism and empathy. How do you handle difficult or emotionally charged situations with patients and their families?
Remember, working in respiratory therapy means you'll be encountering people who are facing serious health challenges. Emotions run high, and it's essential to approach these situations with compassion and understanding.
Right. Focus on your ability to remain calm and composed even when faced with difficult conversations. Highlight your active listening skills and your ability to validate patients' and families' feelings without getting overly involved emotionally.
It's a fine line between empathy and detachment. You want to show that you care deeply, but can also maintain professional boundaries and provide support without letting your own emotions take over.
Exactly. Be prepared to share a specific example of a time when you had to navigate a challenging interpersonal dynamic, maybe with a difficult patient or a distressed family member.
How did you approach the situation? What strategies did you use to de-escalate tension and build rapport? This is your chance to demonstrate your maturity, your emotional intelligence, and your ability to handle sensitive situations with grace. Now let's talk about a topic that's becoming increasingly important in today's healthcare landscape: cultural sensitivity. You might encounter a question like, how do you ensure that you're providing culturally sensitive care to patients from diverse backgrounds?
This question is all about demonstrating your understanding and respect for the diverse backgrounds and beliefs of your patients.
So think about it this way. Every patient comes with their own unique set of experiences, values, and beliefs that might influence their healthcare decisions and preferences.
It's about being aware of those differences, respecting their individuality, and tailoring your care approach to meet their specific needs.
You might want to mention any specific training or resources you've utilized to enhance your cultural sensitivity.
But more importantly, demonstrate a genuine commitment to treating all patients with dignity and respect regardless of their background. Highlight your willingness to learn to ask questions and to adapt your communication style to ensure clear and effective interactions.
And get ready for a potential follow-up question that puts your cultural sensitivity to the test. They might ask, can you describe a situation where you had to adapt your communication style or care approach to meet the needs of a patient from a different cultural background?
This is your chance to showcase your adaptability and your commitment to providing personalized care. Maybe you had to use a translator, adjust your nonverbal communication, or research cultural customs to avoid any misunderstandings.
Highlight your ability to be sensitive, respectful, and resourceful in navigating these complexities. Remember, cultural sensitivity is not just about knowing the right answers. It's about demonstrating a willingness to learn and to adapt to ensure that every patient feels heard and understood. Okay, brace yourselves for a question that delves into the ethical realm. How do you handle ethical dilemmas in your work as a respiratory therapy technician?
This question assesses your understanding of ethical principles in healthcare and your ability to navigate those gray areas where right and wrong might not be so clear-cut.
Remember, you're dealing with people's lives, and sometimes you'll encounter situations that challenge your values and require you to make difficult decisions.
First and foremost, demonstrate a strong understanding of ethical guidelines and principles relevant to respiratory therapy. Then explain your process for approaching ethical dilemmas. Do you seek guidance from senior colleagues? Consult ethical guidelines, reflect on your own values.
They want to see that you don't just rely on gut instinct, but have a systematic approach to handling these complex situations.
And of course, be prepared to share a specific example of a time when you faced an ethical dilemma in your work.
Think back to a situation that tested your ethical compass. Maybe you witnessed a colleague acting unethically or had to make a decision that had conflicting ethical implications. How did you navigate that situation? What factors did you consider? What was the outcome?
The key is to demonstrate your integrity, your commitment to doing what's right, and your ability to balance ethical considerations with legal and professional obligations. Remember, ethical dilemmas are not always easy to resolve, but having a clear process and a strong moral compass will guide you through those challenging moments. Now let's wrap up this question marathon with one that focuses on continuous improvement. How do you approach quality improvement in your work as a respiratory therapy technician?
This question is all about showcasing your proactive mindset and your dedication to enhancing patient care. They want to know you're not just content with the status quo, but are always striving to make things better.
Highlight your understanding of quality improvement methodologies such as Plan Dose Study Act, PDSA cycles, or Lean Six Sigma. Explain how you identify areas for improvement, gather data, and implement changes to enhance processes and outcomes.
Think of it as being a detective for efficiency and effectiveness. You're constantly looking for ways to streamline processes, reduce errors, and improve the overall quality of care.
Be prepared to share a specific example of a time when you identified an opportunity for improvement in your work and what steps you took to implement a change.
Maybe you noticed a recurring issue, a bottleneck in the workflow, or a patient safety concern. How did you approach the problem? What data did you gather? Who did you collaborate with? What was the impact of your efforts?
This is your chance to showcase your analytical skills, your data-driven approach, and your ability to work collaboratively to drive positive change within a healthcare setting. Now, before we move on, let's circle back to RoleCatcher and how their AI can be your secret weapon throughout this entire process.
Remember, their platform isn't just about matching you with jobs. It's about helping you shine in every step of the way. Their AI-powered tools can analyze those tricky interview questions, identify keywords and phrases that resonate with hiring managers, and even provide personalized feedback on your answers.
Think of it as having a personal interview coach in your pocket, guiding you towards crafting responses that are not only authentic, but also strategically aligned with what employers are looking for. It's like having a backstage pass to the interview process, giving you insights that can make all the difference.
And remember, RoleCatcher's resources go beyond just interview prep. Their Career Compass tool can help you explore different career paths within respiratory therapy, identify potential specializations, and even connect you with mentors and networking opportunities.
It's a comprehensive platform designed to empower you throughout your entire career journey. So as you prepare for that respiratory therapy technician interview, remember that you're not alone. RoleCatcher is there every step of the way, providing you with the tools, resources, and support you need to succeed.
All right, so welcome back to the deep dive. We just covered those make or break interview questions, and now it's time to zoom out and look at the bigger picture. Your career trajectory as a respiratory therapy technician. Landing the job is just the beginning, right?
Yeah. Exactly. It's like leveling up in a video game. You start with the basics, mastering the fundamentals of patient care and equipment operation. But where can you go from there?
The beauty of this field is that it offers so many diverse pathways. Remember those career stages that we talked about earlier from the career guide? Entry-level, junior, mid-level, senior. Each with its own unique set of responsibilities and, of course, opportunities for growth.
It's exciting to think about gaining experience, taking on more complex tasks, maybe even specializing in a specific area that really grabs your interest.
Speaking of specialization, the career guide highlights this as a fantastic way to not only advance your career, but also to really delve into an area that fascinates you. Think about it. You could become an expert in neonatal care, working with those tiny little patients, or maybe critical care, where you're on the front lines treating those most severe respiratory conditions.
The guide also mentions the possibility of becoming a respiratory therapist. What's the difference between a respiratory therapy technician and a respiratory therapist? A respiratory therapist is a licensed healthcare professional with a much broader scope of practice. They take on more responsibilities like developing and implementing treatment plans, managing those complex ventilators we talked about, and even educating patients and families on a deeper level.
It sounds like stepping into a leadership role within the respiratory care team.
Exactly. And to make that leap, you typically pursue additional education and obtain the required licensure. The career guide outlines the specific steps involved so you have a really clear roadmap for that journey.
So there's so much room for growth within the field itself. But what if you're interested in exploring opportunities beyond direct patient care?
Well, that's where your skills and experience can translate into other exciting roles. With enough experience, you could transition into management positions, leading a team of respiratory therapists or technicians.
So you could leverage your expertise to mentor and guide others, shaping the future of respiratory care.
Absolutely. Or if you have a passion for teaching, you could explore opportunities in education, training the next generation of respiratory care professionals. Imagine sharing your knowledge and passion with aspiring respiratory therapy technicians, helping them navigate the same path that you've taken.
That's really cool. Now, the career guide mentions a tool called RoleCatcher's Career Compass. What exactly is that, and how can it help someone map out their career journey?
It's a fantastic resource. Think of it as a personalized roadmap for your career, specifically within the field of respiratory therapy. Based on your skills, interests, and experience, it helps you visualize those potential career paths. It can even suggest courses or training programs to help bridge any skill gaps you might have.
Sounds incredibly helpful, especially for those who are just starting out and might feel overwhelmed by all the options.
Exactly. It takes the guesswork out of career planning, and it gives you a clear direction and those actionable steps to achieve your goals. And the best part is it's constantly evolving and adapting to the latest industry trends, so you can be sure you're always on the right track.
Now let's talk about the practical steps involved in getting started as a respiratory therapy technician. The career guide outlines some essential things aspiring technicians should focus on. What are some of the key takeaways?
Well, first and foremost, hands-on experience is crucial. The guide emphasizes the importance of completing clinical rotations or internships in respiratory therapy departments, hospitals or medical facilities.
It makes me think about a story I read in the career guide. There was a student who was initially hesitant about clinical rotations. They were nervous about making mistakes and felt more comfortable in a classroom setting. But once they started their clinicals, they were just amazed by how much they learned from being in a real-world environment, interacting with patients, and working alongside experienced professionals. It completely transformed their understanding of the profession.
That's a great example of how clinical rotations can really bridge that gap between theory and practice. It's that opportunity to apply what you've learned, develop essential skills, and gain valuable experience working as part of a healthcare team.
And speaking of practical skills, the guide also mentions some key certifications that can significantly boost your career prospects. Can you elaborate on those?
Absolutely. Certifications like Certified Respiratory Therapist, CRT, and Registered Respiratory Therapist, RRT, are highly valued in the field. They really serve as a benchmark of your competence, and they demonstrate your commitment to meeting rigorous professional standards.
It's like having a stamp of approval from a respected authority, validating your knowledge and skills to potential employers.
Exactly. Those certifications show that you've gone above and beyond to master your craft and are dedicated to providing really high-quality care. They can open doors to more advanced roles, higher salaries, and even greater job security.
Now, navigating the job market can feel like a daunting task, especially with all the competition out there. Any tips on how to stand out from the crowd?
Remember that digital maze we talked about earlier with those automated recruiter screening applications? Well, that's where RoleCatcher's AI-powered tools can really make a difference. Their CV and resume builder analyzes job descriptions, identifies keywords, and helps you tailor your application to perfectly match what employers are looking for.
It's like having a personal branding expert on your side, crafting a really compelling narrative that showcases your strengths and aligns with industry standards.
It's not just about beating the algorithms, it's about presenting yourself in the best possible light, highlighting your skills and experience in a way that resonates with hiring managers. It's about making a really memorable first impression in this digital world.
And remember, RoleCatcher support goes beyond just landing the job. They offer resources and guidance to help you navigate the onboarding process, connect with mentors, and just continue growing within your chosen career path.
It's a holistic approach to career development, empowering you to not just succeed, but thrive in this ever-evolving field of respiratory care.
This deep dive into the career journey of a respiratory therapy technician has been incredibly insightful. We've explored the diverse pathways available, the importance of hands-on experience and certifications, and the power of leveraging AI to stand out in a competitive job market.
It's clear that this profession offers not just a job, but a really rewarding and fulfilling career with endless opportunities for growth and impact.
But we're not done yet. In Part 3, we'll delve even deeper into the specific skills and knowledge you'll need to excel as a respiratory therapy technician, drawing on insights from the RoleCatcher Career Guide. Stay tuned. All right, so welcome back to the deep dive. We've talked about interview strategies, we've explored career paths, and now it's time to get down to the heart of it. What does it actually take to be an amazing respiratory therapy technician?
We're talking about those essential skills and knowledge that'll not only help you get the job, but will also make you really excel in this role.
Exactly. Think of it as equipping yourself with the tools you need to not just survive, but thrive in this field.
And the RoleCatcher Career Guide is like our treasure map for this journey.
I like that.
It guides us through the must-have skills that every aspiring respiratory therapy technician should have.
Okay, so where do we begin? What are some of those foundational skills?
Well, let's start with the technical side. A really solid understanding of respiratory anatomy and physiology is absolutely essential.
Makes sense.
Remember, you're working with the very systems that keep people breathing.
Right.
So you really need a deep understanding of how those systems work, from those tiny little alveoli in the lungs to the mechanics of breathing itself.
It's like being a mechanic for the human respiratory system.
Exactly.
You need to know every part and how it all fits together.
And speaking of mechanics, the career guide also highlights the importance of being familiar with a wide range of respiratory equipment.
Like ventilators, oxygen delivery systems, nebulizers, all those diagnostic tools.
Imagine yourself in a busy hospital environment. You're surrounded by all these machines that are literally keeping people alive.
It's a lot of responsibility.
You need to know how to operate them flawlessly, understand their nuances, troubleshoot problems on the fly, and always prioritize patient safety.
The guide mentions specific types of ventilators, like pressure-controlled and volume-controlled ventilators. It even breaks down how they work, like the different settings, the types of patients they're best suited for. It's really fascinating to see that science and technology behind these life-saving devices.
It's not just about memorizing buttons and settings, though. It's about understanding the underlying principles that interplay between the machine and the patient's physiology, and then using those critical thinking skills to adjust settings and troubleshoot any problems effectively.
Right. It's a blend of technical expertise and clinical judgment.
Exactly, and that's what makes it so rewarding.
The career guide also emphasizes the importance of assessment skills. So as a respiratory therapy technician, you're constantly evaluating patients, monitoring their vital signs, looking for those subtle changes that could indicate a problem, and then communicating your findings to the rest of the care team.
Think of yourself as a detective. You're looking for clues to kind of unravel the mysteries of each patient's respiratory health. You're gathering information from a lot of different sources, observing their breathing patterns, listening to their lungs, checking their oxygen levels, analyzing blood gas results. So many things. And then you piece it all together to form a comprehensive picture.
The guide actually breaks down the different vital signs and what they reveal about a patient's respiratory status. For example, did you know that a rapid heart rate could indicate a patient's struggling to breathe, their body's working harder to compensate? Or a low oxygen saturation level could be a sign of a serious respiratory problem. It's amazing how much information you can get from those simple measurements.
Absolutely. And it's not just about recognizing those abnormal findings. It's about understanding what those findings mean in the context of each patient's individual situation.
Okay, so we've talked about the technical side, but we can't forget about the human element. The career guide also highlights the importance of interpersonal skills in this role.
Oh, well, for sure.
You're not just working with machines. You're working with people.
People who are often facing serious health challenges and might be feeling scared, vulnerable, overwhelmed.
That's where empathy really takes center stage.
Yeah, putting yourself in their shoes, acknowledging their fears and anxieties, and treating them with kindness, compassion, and respect, even when they're not at their best.
The guide shares this heartwarming story about a respiratory therapy technician who went above and beyond for a patient who was feeling really isolated and lonely during a prolonged hospital stay. The technician just took the time to sit and chat with the patient, listen to their stories, and offer some words of encouragement. It made a world of difference for that patient's well-being and their recovery.
It's those small acts of kindness that can have a huge impact on patient care. Each patient is an individual with their own story, their own fears, their own hopes. It's about treating them with dignity and respect.
Along with empathy, excellent communication skills are really crucial. You're interacting with patients and families, doctors, nurses, other members of the healthcare team.
It's a lot of people.
Clear, concise, and compassionate communication is so essential.
It builds trust, makes sure everyone's on the same page, and fosters a collaborative approach to patient care.
Right. And remember, it's not just what you say, but how you say it.
Exactly.
Pay attention to your tone of voice,
Yeah.
your body language, your ability to listen attentively and respond thoughtfully. And use language that's easy to understand, especially when you're explaining those complex medical things to patients and families.
The guide suggests using analogies, visual aids, even role-playing, to help patients grasp those difficult concepts.
There.
Yeah, it's about meeting them where they are and making sure they feel empowered and involved in their own care.
And remember, communication is a two-way street. Be open to feedback, encourage questions, and be willing to adjust your communication style to meet the needs of each individual.
Because effective communication is the foundation for a strong patient-provider relationship.
Speaking of professionalism, the career guide also emphasizes the importance of maintaining a professional demeanor at all times. This includes adhering to ethical guidelines, respecting patient confidentiality, and representing yourself and your profession with integrity and accountability.
You're not just an individual. You're a representative of the respiratory therapy profession. Your actions, your words, and your demeanor reflect on the whole field.
It's about being reliable, punctual, and always upholding the highest standards of ethical conduct. The guide provides some examples of ethical dilemmas that respiratory therapists might face, like dealing with patients who refuse treatment or navigating those complex end-of-life decisions.
Ethical dilemmas don't always have easy answers, but being aware of those ethical guidelines, seeking guidance from mentors or experienced colleagues, and always prioritizing patient well-being can help you navigate those challenges.
Now let's talk about continuous learning. The career guide really emphasizes that learning doesn't stop once you graduate or get that dream job.
Oh, it's just the beginning.
Healthcare is constantly evolving. To be an exceptional respiratory therapy technician, you need to stay ahead of the curve.
Embrace that mindset of lifelong learning, actively seeking out new knowledge, and constantly expanding your skill set.
Attend workshops, conferences, online courses. There's a ton of resources out there.
Even subscribing to professional journals, joining online forums for respiratory therapists, and following thought leaders in the field on social media.
And don't underestimate the power of mentorship. Finding an experienced respiratory therapist who can guide you, share their insights, offer support.
It's so valuable, especially early on in your career.
It's like having a personal guide through the twists and turns of the profession.
And RoleCatcher can also be your companion on that journey.
Oh, right.
Their Career Compass tool can help you identify skill gaps, suggest training programs, and connect you with mentors.
It's like having a personalized learning plan tailored to your aspirations.
Yeah.
So to wrap up, we've explored the technical expertise. You'll need the empathy and communication skills, the professionalism and ethical conduct that's expected, and the commitment to continuous learning that will ensure you stay at the forefront of your field.
It's clear that being a respiratory therapy technician is more than just a job.
It's a calling.
A profession that demands dedication, compassion, and a relentless pursuit of excellence.
But it's also incredibly rewarding, knowing that you're making a real difference in people's lives.
Helping them breathe easier and playing such a vital role in their journey towards health and well-being.
And with the right preparation, the right mindset, and the right support, anyone can achieve their dreams of becoming an exceptional respiratory therapy technician.
So to all those aspiring technicians out there, take a deep breath, embrace the challenges, and never stop learning.
That's it for our deep dive into the world of respiratory therapy technicians. We hope you found it informative, inspiring, and empowering.
Remember, knowledge is power, and with the right tools and support, you can achieve anything you set your mind to.